Cybercrime is plaguing healthcare in the United States. It's a growing epidemic predicted to affect 1 in 3 Americans and cost $6 billion annually. How concerned should you be about healthcare data security? We took to the streets to find out the public's opinion regarding patient privacy, and here's what they had to say. What expectation do you have of your doctor protecting your medical information?
I would expect them to keep it secure. That's my expectation, because I fill out forms when I go to the office, and I expect them to be within that office and given to no one else.
How would you feel if you found out your medical information was lost or stolen?
I'd be pretty upset and angry, because isn't it their job to make sure that everything is confidential?
Yeah, without a doubt, I definitely feel betrayed, and I wouldn't want to go back.
No way.
Did you know that the government maintains an online wall of shame that lists organizations with breaches of unsecured patient health information?
A wall of shame? That's disturbing to know. That's what you pay them for, to protect your information.
What would you think about a doctor if you learned he or she invested in security measures that help protect patient information?
That'd be great. I mean, it shows that they really care about their patients and that they're making the investments to protect your personal information. I mean, actually, I'm going to ask my doctor when I go back to see what they're actually doing to help protect what I have invested in them. We met with healthcare professionals, the people patients most trust to maintain privacy, and here's what they shared. Why does security and protecting patient health information need to be a priority for healthcare providers?
Number one, it's the law. Enforcement is up, penalties are high, and they really need to be aware of that. But if that's not the main motivating factor, patients are expecting their healthcare providers to protect their healthcare information.
How do you think the opinion of a practice would change if we were to lose patient information or if there was a breach?
I think that if a practice breached information or any information got out, it would be devastating to any practice, large or small. Patients expect great care when they come to your office or your practice or your surgery center, but they also expect their information to be safe.
Doctor, what responsibility do you feel physicians have to protect patient medical information?
I think the physicians have a very important responsibility to protect the patient's information because it builds confidentiality between us and the patient.
What are some of the IT security measures that providers should be taking into account?
The first one is to do a security risk audit. Along with that, though, they should do a vulnerability scan to make sure that all of their IP addresses are secure, and they should also be doing a penetration test. And they want to make sure whoever is doing that is qualified to do that, and once you've done it, you want to do it on some type of regular basis.
So if you had one piece of advice to give to fellow administrators in a practice or in a surgery center, what advice would that be?
The advice I'd give to any administrator or practice administrator is to number one is to understand HIPAA. Make sure your employees understand HIPAA, and make sure you use the right IT partner, such as Priority One, to be able to use all the tools that you have to make sure that the information is safe.
So what recommendations would you give out to other physicians out there, doctor?
One is you should always have written guidelines within the practice. You should have a compliance manual. You should have a physician champion who takes charge of HIPAA regulations, changing guidelines, and a very good HR department who can funnel this through to the practice. Not only that, you need the best resources with an IT facility and company that can protect everything within your practice as if it were their own.
Hi, I'm Nelson Gomes. Patient privacy and security is our priority one. Contact us to learn how we keep your patients from being a cybercrime statistic. Technology made simple. Imagine that.